Good morning, everybody. My name is Jeremiah Pott, and for this final project, I've chosen the topic of understanding what back pain is. Back pain is one of the biggest causes and common factors of why athletes stop playing sports or just people in general that just can't do their everyday normal things because of back pain. So this class is instructed by Laura Cook, and the class is called HPED 334, Summer 1, 2023. Now, the overview of back pain. Back pain can have causes that are due to underlying diseases. It can range from a dual constant ache to a sudden sharp pain that may shoot down the leg. Now, some of the common causes and risk factors that happen to cause back pain is muscle or ligament strain, which is repeated heavy lifting or sudden awkward movement, like playing sports and something happens that puts you in an awkward position can cause back pain in the future. Bulging or ruptured discs, which is when discs can bulge or rupture and press on the nerve. Another two big ones, arthritis and osteoporosis, which are also other common causes of back pain as well. Now, there are three types of back pain when talking about back pain. One of the most not serious back pain is called acute back pain. This happens suddenly and usually lasts a few days to a few weeks. The next one is subacute back pain, which can come on suddenly or over time and lasts 4 to 12 weeks. And the worst of them all is chronic back pain, which may come on quickly or slowly and last longer than 12 weeks and occurs daily. Now, here are some symptoms of back pain. Now, as an athlete, if you are experiencing any back pain, I definitely would recommend you get it checked out before any more serious injuries can happen. For if you're a normal person experiencing back pain, I would also recommend getting it checked out before doing any type of, activity that uses your back, which is mostly everything. Um, so if back pain lasts longer than a few weeks, if back pain is severe and doesn't improve with rest, if back pain causes weakness, numbness, or tingling in one or both legs, if back pain spreads down one or both legs, if back pain follows from after a fall. Let's say you fall down and later at night you're sitting down, you're trying to go to sleep. If that is causing you any back pain, I would also recommend you getting that checked out as well because something could have went wrong, like maybe you herniated disc or something like that. Um, Also, if back pain causes a new bowel or bladder problems, definitely go get that checked out. So, according to Nat's statement and what they, talk about any type of back pain or spinal injury, says anything that is dealing with any type of spinal injury is seriously taken care of. To go forward with that, the president of NATA stated when an athlete is suspected to have a spinal injury, every movement and every movement counts. It is imperative that no matter the level of play from Pee Wee to professional, there's a healthcare professional, such as an athletic trainer, that creates venue specific action plans, leads medical timeouts, and establishes relationships with allied medical professionals to ensure the best possible outcome for the athlete. Now, some of the impacts of back pain for an athlete or for a normal person is activity limitation. Um, Going on with the activity limitation for an athlete, it can cause you to not be able to do these certain types of drills or not be able to participate in this certain event that you guys are having because of how you're dealing with back pain. Let's say if you're a volleyball player, if you're dealing with, or a football player, let's see if you're dealing with back pain, most likely your coaches aren't going to let you go out on the field because getting tackled, it involves with you landing on your back and then hitting you, all that hard movement stuff that is going to possibly make it even worse for you. Not only that, but as an athlete, those who are working while being an athlete, it can create you to be absent from work. There might be struggles standing or just sitting down all day at work, which if you are dealing with back pain, it can cause irritation to your back or your spine, and that can cause discomfort and not let you be able to work. And another impact of back pain is um, it can cause a lot of anxiety, depression, or mental health problems for a lot of athletes. Um, not being able to play in the sport that you love, not being able to participate with your friends, your teammates, people you care about, not being able to compete against other people for others to watch, it can definitely cause a huge toll on somebody's mental health because they feel like they're missing out, or some athletes feel like they're useless. And so there's sociological factors that go with it too. So that definitely plays a big role in impacting an athlete who is dealing with back pain. Another one is financial debt. Uh, Playing sports is not cheap at all. You're dealing with injuries, So if you're dealing with back pain, you're going to hospital visits, you're getting like surgery maybe, and that costs a lot of money. Going to the hospital is not cheap, and that can cause somebody potentially from not playing anymore because of all the injuries that they've had. So they can't do that. Some of the diagnosis and how you figure out if you are having back pain, you can take many steps, such as getting an X-ray scan, which shows arthritis or broken bones. You can go through MRI or CT scans, which generates images that can reveal herniated discs or problems with bones, muscles, tissues, tendons, nerves, ligaments, and blood vessels. And as an athlete, if you are having back pain, there can be some factors outside of things that are happening outside of your body that aren't causing it, but things inside of your body that can cause, reasons for why your back is hurting and such. And you can do that. You can get that figured out with blood tests, which determine whether an infection or other condition may be causing that pain. Another way is nerve studies, which can confirm pressure on nerves by herniated discs or narrowing of the spinal canal. And as an athlete, as a coach, I would tell, going to the doctors, they would tell you a lot of things for treatment options, which is medication, such as pain relievers, muscle relaxants, narcotics, antidepressants. Let's say if you are dealing with back pain and you take some medication before a game, that can also help relieve some of the back pain if it's not anything too serious. Uh, some of the other treatment options to get a player, let's say if you are having back pain, to get back to play, as a coach, definitely make them go through physical therapy, increase their flexibility, strengthen their back and abdominal muscles, and improving their posture. Doing all that stuff, the return to play, that will help the athlete become not new, but to a good point where they're able to come back and compete, hopefully to 100%. And that is through physical therapy that, you know, uh, as myself, that I've gone through, and which helps a lot for athletes. Another one is surgery, which just creates more space within the spine with whatever, you know, injury that you deal with. And some of the preventative measures, as a coach, making them go through physical activity such as yoga, weightlifting, stretching is a good way to help prevent any type of back pain. Strengthening your muscles, but as well as stretching by doing yoga at the same time helps it. When weightlifting and trying to strengthen those muscles, sometimes your muscles are just so tight. So you need some sort of time to help stretch those muscles, help expand them so that they can grow even more. And another one, like I said before, is having good posture, which can also help prevent back pain. Watching your weight, and another big important one for athletes is getting enough calcium and vitamin D. Having the right amount of nutrients can help you perform better as an athlete as well as keep you healthy when you're playing or not playing. Getting enough calcium and vitamin D, it keeps your bones strong and can prevent osteoporosis. And then that is it. Here are my references and citations. Thank you.